Hello students, welcome back to Dr. How. In today's video, we are going to learn about an essential life-saving device, the Ambu Bag. In this video, we will cover what is an Ambu Bag, parts of an Ambu Bag, how does an Ambu Bag works, clinical uses of an Ambu Bag. So firstly, we are going to discuss what is an Ambu Bag. An Ambu Bag, also called a bag valve mask (BVM) or manual resuscitator, is a handheld medical device used to provide positive pressure ventilation to patients who are not breathing adequately. It is commonly seen in hospitals, ambulances, and in emergency situations. Now let's discuss about the parts of an Ambu Bag. An Ambu Bag has several important parts. 1. Face mask. Covers the patient's nose and mouth. 2. Mask cushion. The soft inflatable rim of the mask that ensures a tight seal on the patient's face. 3. Mask inflation valve. Allow proper inflation of the mask cushion for comfort and fit. 4. Expiratory valve. Releases the patient exhaled air safely. 5. Pressure relief or PEEP valve. Maintain positive and expiratory pressure to keep airways open. 6. Pop-off valve. Prevents excessive pressure and protect the lungs. 7. Self-inflating bag. The squeezable bag that automatically refills with air or oxygen. 8. Air inlet one-way valve and oxygen reservoir socket. Ensures one-way flow of air and connects to oxygen sources. 9. Air inlet and pressure release valve. Control airway and prevent overpressure. 10. Oxygen inlet and tubing. Connect the Ambu Bag to an external oxygen cylinder or supply. 11. Reservoir bag. Stores extra oxygen to deliver high concentration breaths. How does an Ambu Bag works? The working principle of an Ambu Bag is very simple. When you squeeze the bag, air or oxygen flows through the one-way valve into the mask and then into the patient's lungs. When you release the bag, it refills automatically with air or oxygen ready for the next breath. The one-way valve prevents the patient exhaled air from re-entering into the bag. Clinical uses of an Ambu Bag. Ambu Bag are used in many critical situations such as during cardiac arrest, to keep oxygen flowing until advanced support arrive. In emergency resuscitations for patients who are unconscious and not breathing. During anesthesia when mechanical ventilators are not available. In ambulances and in emergencies. As a backup for respiratory support. So the Ambu Bag is a simple yet powerful device that can save lives by supporting breathing when it matters the most. Thanks for watching. If you found this video helpful, don't forget to hit the like button and subscribe to Dr. How and tap the bell icon so you can never miss out on simple medical explanations.